Well, thank you so much for coming and for the courage that you have to kind of struggle and wrestle with some pretty important questions, issues that all of us have dealt with at some point in our lives, or will certainly have to, sometime or another, deal with, have to have a say a word either in our own lives or people that we love, people that are close to us, or that we're responsible for, either through work, through nursing, or through family. So I just wanted to, this is a series of 4 topics, 4 sessions. And just to give you a bit of a background, they are based on teaching format, module, that has been delivered in parishes, Catholic parishes, since 2005. I heard about it through, remember a few years ago, we did the pilot project with Costa, who just walked in, who led us into, that we were assessing the pilot projects on bioethics. So I heard about Moira through that, and also then I heard that there was this program, so then I went to our diocese, our chancery, and I spoke to the chancellor, that we didn't have a bishop, and explained to him what we were trying to do and why we were trying to do, and I have his full support and blessing to do it. So that was almost a year ago. Then we talked, Moira and I talked, and I'll introduce her to you in a minute. And we kind of worked out a plan. And the plan is that the first session that we're going to do tonight, we are going to give the foundations of bioethics from an Orthodox perspective. Father Cyprian, who has been involved with the writing up of a summary of the previous thing that we did with bioethics, to present the Orthodox approach to these questions. Also because he's a pediatrician, a doctor, and a priest, and also been involved with this question, it seemed a good fit. And then following tonight's presentation, Father Cyprian will give us the basis of the Orthodox approach. Then Moira will lead us in the next 3 sessions on the practical, look at some of the issues and the questions, the legalities, and what actually is going on in science and medicine, and to try also, always to try to understand how do we look at these things with the eyes of faith. So I just would like to introduce both Father Cyprian and Moira. As you know, Father Cyprian, I really thank you for coming all the way from Montreal for this.
The weather's much better here. It's a pleasure.
Oh, the banana trees are in flowers.
Tomorrow.
So it's a big effort for Father to come all the way from Montreal to give this one talk. So I think just that says what the need is and how great it is the need. We're videotaping this because, as I said, it would be a good tool to have, so that we can't always ask Father Cyprian to come down from Montreal, but on a regular basis, also to give it to individual people who may not have had the courage or could come tonight to be able to be exposed to it. And then also Moira, who is the executive director of the Canadian Catholic Institute of Bioethics, which is affiliated with St. Michael's University, and also supported by the Canadian Conference of the Catholic Bishops. She's also she teaches and lectures theology at St. Michael's University. And the Canadian Institute, Catholic Institute, was started in 2001, and she became the executive director in 2004. Moira has 7 children, 6 grandchildren, and 4 married children. She, prior to doing theology and going around in the different parishes and speaking to people about these questions, she was a lawyer, a family lawyer. and this has been going on. She's been doing this since 2005. So I'd like to welcome both you, Father Cyprian, and you, Moira, to among us. I know also for you it's quite brave to come into an Orthodox context. Very friendly, a little bit.
Let's hope I come back the next 3 nights.
So, and thank you very much for being here tonight, so that you can kind of hear where we're coming from. So, we need some more chairs. Maybe, Kev, can you, before we actually begin, can you just bring down maybe 3 or 4 extra chairs so that we don't have constant interruptions? We will go until 8:30. Father will speak for about an hour, and then there will be ample time for questions and discussion. And then after that, we'll have compline for those who would like to stay to pray. So it should be over by, and as soon as we get the chairs, so that way.
Before we actually start this evening, maybe I was a student for a number of years at the St. Paul University and the Asceticism Institute, and I've also taught there an occasional course, and I teach occasionally in the Orthodox Theology program at the University of Sherbrooke. And a good habit, I think it is anyway, that I picked up along the way is always to start with prayer. So maybe we could sing O Heavenly King. Is that something?
We have the choir.
Okay. Is there a place to face? Well.
So
Okay. O Heavenly King, the Comforter, the Spirit of truth, who art everywhere present and fills all things, treasury of blessings, and giver of life, come and abide in us, and cleanse us from every impurity, and save our souls, O good one. Illumine our hearts, O Master, who love mankind, with the pure light of your divine knowledge. Open the eyes of our minds to the understanding of your gospel teachings. Implant also in us the fear of your blessed commandments, that trampling down all fleshly desires we may enter upon a spiritual manner of living, both thinking and doing such things as are well-pleasing unto you. For you are the illumination of our souls and bodies, O Christ our God. To you we send up glory together with your Father, who is without beginning, your all-holy, good, and life-creating Spirit, now and ever, and in the ages of ages. Amen. It's an absolute pleasure for me to be here. I've had the joy of visiting St. Silouan's a few times over the years, and when Father Roberto suggested some months back coming for this event, I was more than happy to comply. I should warn you that I'm a fairly old-fashioned teacher. I'm not going to use PowerPoint or any other point. I might make use of the board there, although even that I'm not so sure that it will be necessary. And I would congratulate you on your courage and wisdom in having chosen this set of topics for your consideration during the month of January. Just an additional word about my background, which Father Roberto referred to. I have no formal training in bioethics. I certainly wouldn't call myself a bioethicist. I am a graduate in medicine. I practiced pediatrics for many years. I stopped in the year 2006. And alongside that, I had a kind of parallel add-on career as a clergy person. I was a deacon for over 20 years, and then in 2005 I was ordained to the priesthood and served for 4 years at a parish in Saskatoon. I'm now considered to be retired, though I'm not ready to be totally put out to pasture, and I'm more than happy to do some occasional teaching and other events of this kind. In the latter 10 years or so of my pediatric career, I was involved in palliative care for children. I was the director for a number of years of the palliative care program at the Montreal Children's Hospital. And in that capacity, I was also a member of the Clinical Ethics Committee of the hospital as well. I have studied theology in a more formal sense. I have a doctorate from St. Paul University in Ottawa, but it is not in the area of bioethics. So if anything, my reflections this evening are going to be more theological, I would say, than philosophical. As they say in French, point de départ, my starting point for my talk tonight and for the series in general, I hope, would be to try and define and explore with you some first principles derived from the Orthodox tradition that could and should inform Orthodox Christians as they wrestle with the difficult decision-making around a whole variety of bioethical dilemmas that have become a prominent part of 20th and 21st century medical care, particularly in the Western world. I should make it very clear at the outset that I'm not planning to deal, except perhaps in passing, with any of the specific weighty issues such as abortion or euthanasia. These will be dealt with more specifically in Moira's later talks in further sessions. What I'm hoping to do is to elaborate a set of principles based on the Orthodox theological tradition, which I think as Orthodox should inform our consideration of these difficult issues. Bioethics is a relatively new field in general, and if that's the case, one could say that Orthodox bioethics is really in its infancy. And I brought along, just to show you quickly, 2 or 3 of the very small number of specifically Orthodox works that are available in the field. This one by Father John Breck, who I understand has been a visitor here, is called The Sacred Gift of Life, Orthodox Christianity and Bioethics. Father Stanley Harakas of Holy Cross in Greek Orthodox Theological College in Boston put out this book about 15 years ago. It's entitled Health and Medicine in the Eastern Orthodox Tradition. I think this is very well worthwhile for those of you that might have further interest in this. And another person who has dealt from an Orthodox perspective with a number of ethical issues is Professor Vigan Guroian, who's a Romanian Orthodox teaching at Loyola in Maryland. I'm not sure, Loyola University, I guess. This particular book is called Life's Living Toward Dying, and it specifically reflects a number of his interests around end-of-life issues. I actually had Professor Guroian as my external examiner when I completed my PhD, which, as I said, was not on an ethical area, but rather on the Orthodox funeral service and the kind of pastoral theology that it embodies. In the emerging field of what we could call public or secular bioethics, which is predominantly legal and philosophical in orientation, there have been a variety of first principles that have emerged over time, and I just mentioned 2 or 3 of the more important ones. First of all, an emphasis on autonomy for patients, that patients should be empowered as much as possible to make their own decisions. And autonomy in this sense is understood as being opposed to paternalism, that it is not up to doctors or nurses or healthcare professionals or clergy or anybody else to tell patients what they should do, but rather our job as health professionals or spiritual professionals would be to empower them to make these difficult decisions on their own. Closely related to empowering people to be able to make these decisions are notions that are equally important around truth-telling. People have a right to know what's going on and to be explained fully so that they can make informed decisions. and the whole question of informed consent. That when someone is agreeing to undergo a certain procedure, they should know what it is that they are agreeing to. And the third modern principle, if you like, that we could highlight is that of non-maleficence, of not doing evil. There is an old maxim in medicine from antiquity, cave nocias, beware of doing harm. And that remains an important principle in contemporary bioethics as well. Now, as Orthodox Christians, we can view principles like these as generally good and their elaboration as very well intentioned. But my principal criticism of them from an Orthodox perspective would be that, generally speaking, they are lacking any theological foundation. They are derived, for the most part, from what could probably be called a natural law tradition, and this is an area of particularly Western philosophical thought that Orthodox have traditionally been rather suspicious of. So I would prefer, and what I intend to do this evening, is to try and derive some theological first principles based on the theological and spiritual tradition of our church that could act as a sort of set of guiding principles or guidelines that would enable people to tackle some of these really difficult questions. Now, obviously, the guidelines that I'm about to elaborate will speak primarily to Orthodox Christians. They would not immediately allow us to enter into an easy conversation with the wider society, though I think that they can open many doors in that respect as well. But these are not principles that I am elaborating for the purpose of presenting them to the society as a whole, but rather principles that are intended for you, i.e. a group of Orthodox Christians, to think about these difficult questions from the perspective of our church's tradition. And in all of this, we need to remember that in our life as a whole, our fundamental commitment, our most fundamental commitment, has to be to try and discern and then to do God's will in all things. So that's probably the most fundamental principle of all, and one that I think should be understood without further elaboration. So I want to try and identify with you in the time available this evening, and I'll try and watch my time, 4 issues that I think derive from our theological tradition that could condition our thinking as Orthodox about these difficult bioethical issues. First of all, the notion, not unique to Orthodox Christianity by any means, of human beings being created in God's image and likeness. The second principle that I will touch on is the notion that human life, in our church's understanding, is intended to be lived in community. And I would set this to a certain degree alongside, or even in contradistinction to, the contemporary bioethical emphasis on autonomy. We would, which I'll speak more of in a moment, though we have nothing against people being given all the necessary tools to make difficult decisions for themselves, we would understand and emphasize that these decisions normally ought to be made within the context of a community. Natural communities like family, other communities such as the church. Thirdly, the notion derived from Father Brecht's book of human life as a sacred gift. And the last point that I would like to spend a little bit of time on is what I would call the ascetical dimensions of bioethical reflection, based on Christ's invitation to take up one's cross and to follow him. So let's begin then with the notion of human beings' creation in God's image and likeness, what we would call Christian anthropology. This is an attempt to wrestle with and to answer the fundamental question of what is a human being? What is it that makes human beings unique and infinitely precious, as Jews and Christians have asserted for many centuries? Most Christian anthropologies at some point either begin with or refer to the verses from Genesis chapter 1, verses 26 and 27, which I'll just read to you now in the version taken from the Revised Standard Version of the Bible. And so God says in Genesis 1, 26, 27, "Let us make man in our image, after our likeness, and let them," notice the movement back and forth between singular and plural, "and let them have dominion over the fish of the sea, and over the birds of the air, and over the cattle, and over all the earth, and over every creeping thing that creeps upon the earth." So God created man in his own image. In the image of God, he created him. Male and female, he created them. So this interesting movement, which we will not spend time talking about tonight, back and forth between the singular and the plural, him and them. Now this idea of creation in God's image is something that is common to most Christian anthropologies, Protestant, Catholic, Orthodox, and others. The, if you like, unique Orthodox twist on all this is the emphasis on creation and human beings' existence according to God's likeness, that is, to both the image and the likeness. This is a distinction that probably doesn't exist in the original Hebrew text of the Old Testament, but when the Greek fathers studied the Greek versions of the Old Testament scriptures, they laid a lot of emphasis on the relationship between being created in God's image and growing into God's likeness. So according to the most typical Orthodox patristic anthropology, it is the teaching of our tradition that human beings have been created in God's image, and that this image cannot be destroyed or lost. It can be defaced, it can be tarnished, it can grow dusty, it can almost disappear, but it can never be lost. And so for this reason, Orthodox have always been very suspicious about any theology which has talked about the total depravity of the human species. All human beings, no matter how apparently depraved, no matter how apparently imperfect or fallen they are, still bear, in the Orthodox understanding, this nucleus of the image of God into which they've been created. This is a kind of sobering thought when we think about people like Hitler and Stalin. It's not so immediately clear whereabouts the image was in those two particular gentlemen, though our spiritual tradition, which emphasizes not judging people, also has to leave open the possibility and live with the possibility that on their respective deathbeds they may in fact have repented and come to live in God's grace. So every human life, no matter how seemingly imperfect it is sacred. Our human vocation, having been created bearing the image of God, is to grow into God's likeness, a process that in our tradition is referred to as theosis or divinization. It is also, I think, probably very much what St. John is talking about in his Gospel when he talks about eternal life. Because when you read John's Gospel, it's quite clear that eternal life for him is not some sort of heavenly kingdom, some sort of pie in the sky when you die, but rather that eternal life is a quality of living. It's a process that starts here and now, but which will only be fulfilled and completed in the life beyond this life. How is this growing into God's likeness accomplished? There are various means according to the Church's teaching: repentance, ascetical efforts such as fasting and the other disciplines of the church, regular reception of the sacraments, the practice of the works of charity, almsgiving, sacrificial almsgiving, for one. The image and likeness are reflected, according to the Orthodox understanding, in both the physical body of human beings and in their non-physical components, the soul, the spirit, and the intellect. It is the clear understanding of our tradition that this living matter of our physical bodies, what St. Paul calls the flesh, is gradually capable of being revealed as a sanctified body, a temple of the Holy Spirit, as St. Paul says. And it is for this reason, for example, that we venerate the relics of the saints. It is our belief that due to their growth in God's likeness, that even their very physical bodies have been permeated by the Holy Spirit. And it's interesting that in our funeral service, the physical remains of the deceased in Greek or Slavonic are in fact referred to by exactly the same word. They are called relics. And for that occasion only, we treat them exactly as we might the relics of the saints. They are incensed repeatedly, they are reverenced, they are kissed. A sign of the fact that we believe that a physical, living human being who has been baptized, who has communed regularly, who has been anointed, who has entered into the sacrament of marriage, has, to a certain extent, begun the journey to become a sanctified whole person, body and soul. The importance for action of all of this is seemingly paradoxical. On the one hand, Christians are those who must reverence human life in its entirety, body, soul, mind, and spirit, as something ultimately sacred. But we remember at the same time that the fullness of life, the life in the kingdom, will only be realized beyond this life. So Orthodox ethical reflection, I would contend, is typically this worldly on the one hand, but also has a very strong transcendent dimension, realizing that the really real lies beyond and beneath the world in which we find ourselves living at the moment. The second basic principle that I would want to identify and dwell on for a few moments is the notion of living in community. Now, I mentioned a few moments ago the importance of autonomy as a principle in contemporary bioethics, and indeed I think it bears within itself much good. Gone are the days, at least in North America, when it's acceptable for a physician to say to a patient, "Now, dearie, don't you worry, you just leave it to me, I'll do what's best for you." That's not acceptable anymore. Unfortunately, as I neared the end of my medical career and saw more and more physicians who had been, if you like, brainwashed regarding this notion of autonomy, I think things went to the completely opposite extreme. A doctor would come into the room and say, "We could operate on you, we could treat you with pills, or we could do nothing. What do you want us to do?" Well, this is an incredible burden to drop in the lap of a patient or family. I would say that the healthcare professionals are abandoning the patients. But properly understood, autonomy is intended to imply that patients are to be given, where, to the extent possible, depending on background and intelligence and education and so on, the necessary tools to be able to make their own choices. And as far as that goes, I don't think that I, as an Orthodox, and in particular as an Orthodox physician, have any major quarrel with that principle. But at its root, I'm afraid there lies, or is coming to lie, an undue emphasis on individual persons making their own choices. And some of this emphasis on individuality is, I think, probably inherited in the Western world from the Protestant Reformation and the Enlightenment. Both movements which have tended to stress that either through, in the case of the Reformation, people reading the Bible for themselves, or in the case of the Enlightenment, people using their unaided human reason, that this will allow people to decide on courses of action by themselves. There is an undue emphasis, Orthodox would maintain, in much Western thought on the individual, understood in a kind of atomistic sense, as opposed to the person who, in the Orthodox understanding, is always understood as someone who lives in relationship with other people and in communion with them. Just as an aside, there's a story that I heard a couple of years ago about a fairly famous elder from Mount Athos who was visiting in one of the larger Greek cities of Athens or Thessalonica, doesn't make much difference. And he was accosted by an evangelical Protestant, a Greek. And he sort of grabbed this Athonite elder by the sleeve and said, "Father, do you have Jesus Christ as your personal Savior?" And the Athonite elder paused for a minute and he said, "No, I like to share him." And I think that little vignette, though, emphasizes a certain tendency, and I don't want to emphasize this too much, but a certain tendency in Western thought, modern Western thought, to see the isolated human person as the measure of ethical good. But for Orthodox Christians, this undue emphasis on individuality and autonomy flies in the face of evidence, both natural and revealed. We are born into natural communities, the marital couple, the family, the tribe, or the nation. It seems as though we human beings are created to live in relationship with one another, and the Orthodox would maintain this is a reflection of the fact that God Himself is a relationship, Father, Son, and Spirit. These natural human relationships are supposed to be perfected and fulfilled and realized through life in God's new human community, which is the Church. Alexei Khomyakov, who was a famous lay Russian theologian, religious thinker in the 19th century in Russia, said, "No one is saved alone." And that is, I think, for the Orthodox tradition, a very fundamental insight, and it's sort of thinking along the same line as the Athonite elder who wasn't very impressed with the notion of me and Jesus all by ourselves over in the corner. It has to be me and you and you and you and you and Jesus. The cement that holds this life in community together is love. That same love that flows naturally, one might say, between the various persons of the Trinity, and into which we are invited to enter as well. This lack of understanding of the communal nature of much decision making, I think, is leading to lots of grief on the ground in modern day teaching hospitals, especially in large multicultural cities like Montreal and Toronto, where you have all kinds of people, many of them coming from rather traditional societies who have not lost the sense of human beings as people who live in larger units, be that family or ethnic group or religious community. And I'd like to share with you a story that comes out of my own experience as a physician. Took place about 15 years ago. It concerns a young man who we'll call Steve, who at the time in question was 17 years old. Steve was a Greek-Canadian by background, and he suffered from an inherited condition known as beta thalassemia. This is a severe form of anemia affected individuals receive one abnormal gene from each of their parents, so you have to have 2 genes in order to have the disease. So the parents are carriers, but they themselves are not affected. But they still have to live with the knowledge that it is, if you like, their fault that their child has this disease. The only treatment for this condition is regular blood transfusions, usually on a monthly basis. And that's fine as far as it goes, except that with each blood transfusion that one receives, one gets a very large dose of iron. You know that the red blood cells in the blood transfusion are full of iron. Our bodies have no natural way of getting rid of iron, and eventually, after people get many transfusions over time, the iron builds up in the various tissues and vital organs and does severe damage. Beginning in the 1980s, however, a new treatment became available, a medication that had, unfortunately, to be given overnight by continuous infusion with a little needle stuck under the skin. And this medication sopped up, if you like, the excess iron and led to its being excreted in the urine. At the time, however, when this treatment became available, Steve, the young man that I'm going to tell you about, was already 8 or 9 years old. He obviously didn't like the idea of having a needle stuck in to his body every evening, and his parents, who already felt very guilty for having inflicted him with the disease, just couldn't insist that he use this treatment. As a result of this, he had a certain amount of heart disease already, and more specifically, his physical development was lagging behind. At the age of 17, he had no signs of puberty. He was short, and if you met him, you would think at first that this was just a child or a boy, although he had a wonderful wit and was very intelligent and certainly knew what was going on. As happened, unfortunately, in the 80s, Steve received a unit of blood at some point which was contaminated with the HIV virus. And he became HIV positive. It was quite obvious that his health was beginning to deteriorate. He was losing weight. His appetite wasn't very good, which for a Mediterranean parent is a near disaster to begin with. And I had, along with the social worker and the nurse, a very difficult meeting with Steve's parents. First of all, to let them know what we had discovered about the fact that Steve was HIV positive. There was very little treatment at that time for people who were HIV positive, and although we didn't lay great emphasis on it at this point, we did mention the fact that it was probably going to shorten Steve's life. Based on kind of my ethical instincts as a then 20th century Canadian physician, I felt that it was very important that Steve be told what was going on. Steve, after all, he was 17. Even though his physical body was childlike, he was very bright, he did well in school, and I thought he would be able to understand, and I felt that I could explain it to him in a way where he would understand so that he could cooperate with whatever treatment there was going to be, and without necessarily removing all hope. This was absolutely unacceptable to the parents. In Greek culture, it seems to be the case that it's accepted that what people don't know won't hurt them. If I could put it, I don't mean to be so flippant, but that's kind of the way it is. And they were insistent that he not be told. And I felt myself caught between my wish to honor what they wanted, and at the same time to fulfill my responsibility to Steve and to tell him at least the rudiments of what was going on so that he could understand what was happening to him in the weeks and months ahead. So I'll pause there for a minute, and maybe if I haven't put you to sleep with the lengthy story, what would you do? I'll tell you eventually what happened, but what are we going to do? Are we going to honor the parents' request and hide this information from Steve, or am I going to go against their wishes and tell Steve anyway? Yep.
Well, I think Steve knows he's sick.
He knows he has, yes, he knows, he must know that he's losing weight.
Side effects and everything, so it makes lots of sense to tell him.
Right.
Like, if he doesn't have any, you know, physical change, but probably not, I couldn't tell him, but if he's going through this severe change.
I guess the thing to remember is that in the early 80s, that telling someone they were HIV positive was tantamount to saying, you're going to die, because the popular belief at that time, borne out most often by experience, was that, you know, if you became HIV positive, the chances were you were going to die within a couple of years. And everybody kind of, that was out in the mill. So to tell him about his HIV positivity, probably he would have, you know, put two and two together. And his parents were dreadfully afraid that if he did that, he would lose hope. But anyway, there's room for negotiation and discussion. Yeah,
just a quick cut. Isn't there an obligation to tell in case he harms others by not knowing?
Well, you're right, basically, yes. I think the fact that he was so physically immature and prepubertal, at least for the time being, you know, he wasn't going to become sexually active. He certainly wasn't going to become a blood donor, since he, you know, was in need himself of regular blood transfusions. But it's a good point, though. It certainly ought to influence this kind of thinking. Yeah.
From a medical obligation, point of view, would you not be obliged as a doctor to tell him, because he's over 14? So
yeah, and in Quebec, especially, that was yes. Yeah.
Coming from that culture myself, I've always found that there's been a weakness within the culture, and I have a daughter who has suffered over the years from chronic health issues, and on coming to Canada, she was taken into a program at Sick Kids Hospital, and I was quite astonished to see her specialist involving her in treatment and discussing options with her and all the rest of it. And although she's 10 now, so she's very young,
yeah.
I found that she was empowered by having greater amount of knowledge. And yet at the same time, like I said, I come from that culture that we do it differently, and in some ways it's a huge frustration to me, because I can see that there's a different way that's better. And I mean, thalassemia, I have one son who's a carrier of thalassemia, and you don't, I mean, maybe now it's different. In the 1980s, when my son was born, you wouldn't even have dreamed of telling anybody that you were a carrier, that you'd given birth to a child who tested
because he might not get married.
Well, yeah, exactly, you know, especially if it was a girl. Oh my gosh.
Yeah. Yeah.
I just, because I did my undergrad in genetics, so there were a lot of bioethical stories, but one strikes to mind right now, which was sort of also a dilemma in the case where there was a lady that was actually adopted into a family, but she was already in her 20s or so, and her family never told her that she was adopted. But she did have, so her adoptive mom, they also had a daughter, so their birth daughter, and the mom ended up having breast cancer and the BRCA gene. And so the daughter, also their biological daughter, also ended up carrying the gene and having breast cancer. And now the adopted sister, thinking she's also the part of the family, wants to go out without testing and have preventive surgery and all that sort of stuff. Everyone, like doctors, are trying to encourage her to do testing, but knowing her high chances, she refuses, and she just wants to have the surgery. And so the parents refuse because they think he'll have too much emotional harm to tell her that she's adopted. They won't tell her that, and the doctors are trying to get them to tell her. So she's scheduled for the surgery, and with probably very low chances of actually having the gene because she's adopted, and refusing to get testing. So it's also the dilemma in that case of
Yep.
through the doctor.
There's an old saying my grandmother used to say, "Oh, what a tangled web we weave when first we practice to deceive." And, you know, so that's exactly what I was faced with here. So I'll tell you what I did in the end, and because I want to finish my formal presentation and leave some more time at the end. What I told the parents was the following. I said, for the time being, I would honor the request that I not tell Steve directly, that I not make a point of telling him deliberately, but that if at any time I sensed he was asking questions or asking for more information, particularly if he asked me outright about, you know, well, what's going on right now, why am I getting sicker, I would feel obliged to tell the truth in as gentle a way as possible. And they understood that, and they respected my choice. That if I felt obliged to tell him, I would tell him. As things happened, Steve never asked a word, and he died about 18 months later. But that was a very, I think that's a good example of a difficult medical decision being made within the context of a community. You know, they came from a large, very supportive family. These people couldn't have managed dealing, and they had a second child with the same condition. They couldn't possibly have managed with these two kids without the support of this wide family. They didn't want them to know. They didn't want Steve to know. These are, you know, cultural values that, and I didn't make this decision alone. I mean, we operated very much in the thalassemia program in Montreal as a team. We felt obliged to try and sort of steer a midway course between truth-telling and honoring the kind of community context of this child and family. Okay, well, to move on then, the third principle that I would put forward as being central to Orthodox is the understanding of human life as what Father Breck calls a sacred gift. In a very real sense, Orthodox Christianity would insist that my life is not my own. It comes to me from God, and in a very real sense, it belongs to Him, and I am accountable to Him for the way in which I conduct that life. And my life is not given by God just to me to do with as I wish. It is also a gift to my family, to the wider human community, and to the Christian community, which is the church. So this is a thought, I think, that comes out of the previous two principles, that namely of being created in God's image and likeness, and secondly of living a life in community. This gift of life is to be used in certain quote-unquote appropriate ways, appropriate to the nature of the giver, and to life's gifted nature as something to be cherished. And ultimately, in the Christian understanding, this gift is to be offered back to God in faith and love as our gift to Him. And Orthodox Christians would insist at a time of His choosing. This understanding of life as a gift, I think, has two important connotations for ethical reflection. On the one hand, human biological life is not to be disposed of or dispensed with or given up casually, but on the other hand, it is not to be clung to officiously in an unreal manner. And if I could illustrate what I'm trying to say here, I would just refer to some of the issues that come up nowadays in some of the debates around various sorts of end-of-life issues. The whole notion of assisted suicide. The fact that I decide that I am suffering too much, and when I'm ready, I will bail out. I realize that putting it this way, I may be being a bit harsh. There have certainly been some very empathetic presentations of the dilemma in which people find themselves when they suffer, for example, from a disease like Lou Gehrig's disease, which is a terrible affliction. But this notion that I am a free moral agent and that I can, when it's time for me to leave, I can choose to leave, I think goes very much against the notion that my life as a gift from God does not belong exclusively to me. It has been given to others, to my family, to my spouse, to my community, to my church community if I have one, and that all of these people need in some way to be involved, at least in my mental consideration, in the decision that I'm making. And on the other side of things, in the end-of-life debate, we have the whole situation sometimes with the medical professionals, sometimes with the family, where people just can't let go. It's clear that someone has a terminal illness from which they're dying, that all of the conventional treatments have failed, and despite this, people are lying in hospital, continuing to receive certain medications, intravenous fluids, sometimes even artificial feeding. And it seems to me that in the context of viewing life as a gift, which ultimately has to be offered back to God, that this overly zealous striving to keep someone alive when there is in fact no hope of a cure, no hope of their returning to any kind of normal human existence, is an offense against this principle of seeing life as a sacred gift, as Father Brett calls it. And finally, the fourth principle that I want to touch on is what I am calling the ascetical dimension of bioethical reflection, the notion of taking up one's cross. And let me explain what I mean by this. All of us in this present life, sooner or later, are going to encounter our personal cross or crosses in the form of unexpected or unwanted suffering. That cross may be an illness, it may be becoming aware that we are in danger of death imminently, it may be the loss of a loved one, it may be family breakup, financial stress, aging, loss of faculties, you name it. But sooner or later, there is some form of suffering, some form of crucifixion, if you like, going to come into every human life. Now, we Christians often get a bad rap from the non-Christian public as the people who believe that, quote-unquote, suffering is good for you. It'll make you a man. But the truth is, there's no escaping suffering. It enters every life, sooner or later. And the real question, it seems to me, is what do we do with the suffering? Do we allow it to destroy us? Or, if it is embraced somehow willingly in union with Christ, can it become a means for our salvation? The late Father Alexander Schmemann was fond of saying that the whole of spiritual life consists in how we play the cards that life has dealt us. We have no choice about the cards. You know, somebody once did a study on the influence of all the various environmental factors on health, on heart disease. And the only conclusion that they could reach at the end of looking at all of these studies was to say, it's very important to choose your parents carefully. But it happens that those are a couple of the cards that were dealt. We can't change them, we can't return to sender. We have to deal with this. So, in a very real sense, when suffering enters our lives, we have really only one choice. We have to play the cards in such a way that little by little by little we can see a way through this suffering to allow it somehow to transform us for the better. Now, this is a very easy thing for we clergy to stand up there and blah 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 about. I can only say, without going into detail, that I have a little bit of personal experience in this regard, and without going into detail, as I say, but the day after my 22nd birthday, my father, who was 48, dropped dead. I couldn't think at the time of anything more awful. I didn't want to deal with it. I had no intention of dealing with it, but it was there. And I realized in retrospect over the years, and it's soon going to be 50 years since he departed this life, that having had that experience at such an early age came little by little, I think, to do something good for me. I think that I often was rather callous about other people's hardships. And having had to live with a major hardship at an early age, I think made me just a little less callous than I might have been otherwise. I like to think so. But in this context of embracing and not allowing suffering to destroy us, I think is exactly what Christ is talking about in the Gospel when he invites us in those amazing words, Matthew 16:24, parallels in Luke 8 and Mark 8. And he says, if anyone would be my follower, my disciple, let them deny themselves, let them take up their cross, not his cross, but their cross, our own cross, and follow me. What we mean by asceticism is simply the process of learning to say no to ourselves in order to be able to say yes to God and to others. And it seems to me that many of the difficult decisions that people wrestle with are predicated on the notion that above all else I must avoid suffering because it's a bad thing, and in order to do that I'm willing to undertake some, from our perspective, very morally questionable activities. Let me read, and I'm nearing my conclusion, just a few words. I've entitled them wise words in quotation marks. The reason I can say that is they're mine. And they're taken from a, this is the final, or the nearly final version of the genetics and faith curriculum, which a group of you here worked through a number of years ago. And it includes in its final version a very good series of appendices for the different Christian confessions. And I wrote the one for the Orthodox tradition. But in that, and the only reason I'm quoting myself is that I think I said in those few words what I really want to say now, which is kind of my take-home point. And I wrote as follows: there can be no doubt that being afflicted by and living with chronic handicapping or life-limiting illness imposes tremendous burdens and much real hardship, much suffering on the person afflicted as well as on their parents, families, and other caregivers. To seek to avoid such burdens at any cost might seem, at first sight, to be nothing more than a normal, totally understandable, and very human reaction. The termination of an unwanted or inconvenient pregnancy. Allowing someone who is dealing with a terminal illness to decide to end their life in order to avoid further suffering. This may seem a very normal and understandable reaction. However, Orthodox Christians who may be contemplating having recourse to one or other morally questionable new technologies, for example, prenatal diagnosis for the abortion of a fetus with a genetic disorder. People thinking about using one of these would do well to bear in mind and to reflect upon the whole ascetical dimension of traditional Christianity. We Orthodox Christians believe that we are enjoined by Christ to deny ourselves and take up our cross in order to follow him and become his true disciples. Viewed in this way, disability, suffering, and its attendant suffering, embraced willingly for Christ's sake and in witness to the gospel, can become a way into the kingdom for both the disabled persons and their caregivers, and in addition is a very powerful witness to the wider community. And I'd like just to share another story again from my own experience. It happens that this is another Greek family, but it's not meant to be a let's pick on the Greeks night. These people were friends of mine. They were also my patients. A young couple, both in their late 20s. And when the wife gave birth to their third child, very unexpectedly, he turned out to have Down syndrome. This is not something that could have been foreseen in any way. She was a young woman, not in the usual age group where this becomes likely. When the parents were tested, they were not carriers of the abnormal gene. It just happened. And this was a terrible blow for this couple, especially, I think, for the father. The father was a bright, energetic, intellectually curious, good guy. But I think for him, the thought of having a mentally handicapped child was almost more than he could bear. And his wife, I think, felt, under the circumstances, that if she could not count on his support, she was not willing to try and raise this child by herself. So they were debating very seriously about giving up the child for adoption. It's not exactly a bioethical decision in the usual sense, but a difficult decision, a difficult situation. And all I can say is that they finally were able to see, because they were people of deep faith, first of all, that this would be a violation of the gift, if you can call it that. They certainly were finding that difficult, but the gift which God had given them, and the fact that it might entail for them some temporary hardship, but that they could live in hope that things would gradually get better. They were able to meet, for example, a couple of families who had children with Down syndrome, for whom these children had become a very important and very precious part of the family. So after wrestling with this for nearly 6 months, they finally were able to embrace this, recognizing that this was going to very much change their family life. It was going to introduce all kinds of extra little twists and kinks into their life together. But they kept their son George, who is now nearly 20. When the Special Olympics took place in Greece, he was kind of the poster boy on Greek television. He's done very well. He speaks 3 languages, not perfectly, but neither do I. And he has been an incredibly precious part of their family. And I think as they wrestled with this, they were somehow able to see their way through to embracing this and to trusting in God, one presumes, to allow it to become something that ultimately they hoped would contribute to the well-being of their family. So, just to wrap up, and then we'll leave time for questions and discussion, I'm trying to suggest that the approach of Orthodox Christians to bioethical tough choices must be conditioned by and based upon 4 cardinal principles derived from our theological and spiritual tradition. And there may well be others, and I would love to hear from you any comments or suggestions that you might have about additional possible important principles from our tradition that I may have overlooked. And just to recap, those 4 principles are the notion of human beings created in God's image and likeness and therefore as infinitely precious. The reality that life is ultimately lived in a community, and for us that most fulfilling community, if you like, is meant to be the Christian Church. Thirdly, the notion of life as a sacred gift. And lastly, this notion that I just finished on about being willing and able to take up one's cross rather than opting for what at least superficially might seem a much easier way out that will avoid the burdens of suffering and the attendant miseries that will produce. So I thank you for your attention, and if you have questions or comments, I'd be just delighted to hear them, and I hope we could have a bit of discussion if possible.
Question.
Yeah.
Okay, so I know that there are some cases where it's very, very expensive to continue keeping people on life support, probably in most cases. So I was just wondering, what consideration does sort of society's limited resources have towards, maybe this is impinging on other talks, but what consideration does sort of taking resources away from other people for a certain individual have on these decisions?
There are important issues of social justice involved in medical care as a whole. You know, if the system has $100,000 spare dollars, do we invest that in a new MRI machine, or do we devote that money to making sure that Toronto inner city kids have completed all their immunizations? I mean, there are all sorts of you know, where do we spend the money that we have, and it certainly arises in the chronic care of the disabled. The truth of the matter is that, at least as far as disabled children are concerned, the vast majority of them, in my experience, are being cared for at home, with very little. You know, it's true people will get a handicapped children's allowance and you know, probably some visits from social workers and things, but they're not really costing the system very much money. Where it becomes more difficult is this case that some of you may have seen recently on the news of the man who is really living, I think, virtually in an intensive care unit, who had some kind of major, I think he had a stroke or a brain tumor, but he really was thought to be in a persistent, like basically to be a
the minimally conscious man?
Yeah. And now, so there was a movement on one hand to...
That's the case I was thinking of.
Yeah, to withdraw his life support because he was on a ventilator.
And $2,000 a day?
Yes.
That's probably...
Yeah. And, you know, I don't know the answer to that particular question. To me, from what little I saw of him on television, he's not in what would be called a persistent neurovegetative state. He had his eyes open, he was aware of his wife's presence at the bedside, he was able to respond, and I think even to have some kind of simple conversation. What I would, based on my experience at the Children's, we had a fairly successful home ventilation program. And I think if this man is going to continue to be alive, at least the locus of his care should be removed from the hospital setting into the community. That could, I believe, be done. But from what little I saw, without knowing any medical details, I would have found it very hard to make a decision to withdraw the treatment. I think that would have been both unethical and immoral, and probably even illegal, because I don't think...
It was the doctors who wanted to withdraw the
Yeah.
treatment.
And I believe that they're both, I don't think they were just being, I think they felt, you know, he's taking up an intensive care unit bed. There probably are people at that very moment in the emergency department who needed it, you know, more than he did. I understand where they're coming from, but I don't think withdrawing his treatment is the, not a way to go.
Thank you.
Yeah, yeah.
I just have a story, I guess, to sort of add on to that in a way. About, I think it's been about 15 years ago, one of our friends, her brother's girlfriend apparently found out she had cancer, and it had spread, and she was given 3 months to live. So essentially, doctors were rejecting any sort of therapy or anything, and the doctor asked her, "Where's your church so I can go and light you a candle?" She didn't want to give up, and she literally said, I want to do chemo, I want to do everything, I'm not giving up. And he said, well, you know, not directly, but indirectly, like, we don't have beds for you, like, you know, you shouldn't be taking up beds in the hospital. And she said, you know what, I'm going to bring my own bed from home. I mean, at the end of the story, she's alive this day. So 15 years ago, she had 3 months to live, and now she is here today. And had she probably not taken up her cross and been so persistent, that wouldn't have occurred. But I mean, they were trying to save beds too, like, or at least give them to other people. So
Yeah, it's an issue, and I mean, I didn't reflect upon it or include even any grounds for reflecting on, because there's a whole social justice issue that I didn't even really touch upon, and it's becoming a major problem within our healthcare system as we elaborate more and more costly treatments and technologies that are applicable to an extremely small segment of the population, while other people are not having even rudimentary needs met. But anyone else want to, Michael? Somebody, yeah.
Well, I just wanted to say that, I mean, when you talk about the girl basically demanding to receive treatment for her cancer, even though, you know, they considered outcomes were not going to be good. I know of a case where the prenatal testing for women over the age of 35, and it's recommended, and I hadn't realized, I thought there was laws here in this country that, you know, abortions were not allowed over the time of 20 weeks or whatever. Anyway, so testing was arranged for 24 weeks when there wouldn't be any issues, and the testing, it was actually just ultrasound, and they said that the ultrasound showed that the child would be abnormal, possibly with Down syndrome, and certainly possibly with skeletal abnormalities. I mean, this is a couple years back now, and I think ultrasounds are probably better now, but the woman involved was not willing to, certainly at that late stage, to undertake the suggested abortion of the child that was going to be abnormal. And lo and behold, the baby was actually born perfectly normal. Yeah. You know, so it's like, she would have been on the safe side, quote unquote, of, you know, saving herself from suffering per se, had she had an abortion. But on the other hand, and she's, you know, she said after, she says, well, even if the baby had had Downs or something else, she says, I still would have, you know, I would hope that I would still have been able to love it. So, I mean, you know, your friend was diagnosed, diagnosed as terminal and survived. You know, babies are diagnosed in utero as having issues who maybe don't have issues. I mean, we aren't God yet.
That's right. I do think, like, one of the important things is that there's statistics. Like, you have a 9 in 10 chance of dying, which means that, like, in this room, one of us knows somebody that's beaten those odds. But like, the question of whether you devote, you know, the resources to the person that has a 1 in 10 chance of living or a person that has 5 in 10 chance of living, that's a hard choice that I don't think any of us wants to make, but it has to be made in some macroscopic way, and we're often too much more willing to just not think about it and kind of push it in the back instead of thinking about that fact that we're doing that every day.
I think it's quite easy to focus on our attention for discussion and otherwise on these kind of situations that I would say are probably relatively uncommon. and overlook the fact, and that I think this is where it's good for us to think about and to be informed about these ideas. I think a far more common situation is something like the following. An elderly parent in their late 80s who's had 2 or 3 strokes, happens to be in hospital. There's no active treatment other than a bit of physio being given, and the person is reluctant to eat and drink. Now, sometimes it's the medical professional, sometimes it's the family, sometimes it's both. People feel obliged to begin to do interventions. They're not major or costly, just putting in an intravenous or putting down a nasogastric tube. But I think where people, and especially I think from our perspective, that we believe that by God's providence that the time for our death will come. When people were at home for the most part when they died, it was a natural thing to stop eating and drinking as you neared the end of your life. I mean, that's part of the dying process. So is it not being unnecessarily officious, striving too hard to keep this gift which God has given to us instead of offering it back to Him when we begin to undertake these exceptional issues that they're not going to change anything except they're going to prolong probably the suffering of the person. And contrary to what many people might think, if someone is in a state like that and stops eating and drinking, if their mouth is kept moist and there's some simple measures to keep their oral hygiene attended to, they can be made very comfortable and nature can take its course. And I think sometimes there's some very unfortunate interventions that are, then the person gets an infection. You call in the infectious disease specialist and begin giving them high-powered intravenous antibiotics, or do you, pneumonia used to be called the friend of the terminally ill. I mean, you have to die of something. And, this anyway, that's just, yeah.
When you talk about taking up your cross and sort of dealing with what you've been dealt, where does the line get drawn when you have, when do you get an intervention done, and when would you bear it as your cross? You know what I'm saying? Would you get an intervention if it's the reasonable thing to do, always, or is it ever?
Well, I wasn't meaning at all to be speaking against intervention. I mean, if someone's suffering because they have a broken leg, the leg should be set and they should be put in.
And if you have cancer, you should take all reasonable.
Right. But I was thinking more in terms of some of the complicated, if someone.
If it gets very complicated, then you wouldn't. But what if one day?
Or if the way of dealing with it is ethically questionable. Let me give a simple. You're 40 years old. You're having your first child. You're an Orthodox Christian. Should you have amniocentesis? Does everybody know what sampling of the amniotic fluid to see what the genetic composition of the fetus is? What's the purpose of doing that amniocentesis in anyone?
There could be a good reason for that, because if there's a risk for the child to have a disability, then it's good to be prepared. It's rather than have it come and then you're in shock and you can't, interact with your newborn child. If you've already come to terms with it beforehand.
But the intention most of the time when the amniocentesis is done is to offer to families the option of terminating the pregnancy so that they won't have to deal with the difficult child.
Right.
And in my experience, I'm not sure that it's much, to tell a woman who's got 6 more months of pregnancy left that she's carrying a child with Down syndrome, I'm not sure is doing her any favor in terms of, it's important that pregnant women not be unduly stressed, et cetera, et cetera. I think that would be an individual thing. I suppose if someone said to me, I know that I carry the gene, because there are a few people who carry a gene that they themselves don't have Down syndrome, but it can affect their one of their children, if they said, I want to know whether my child has Down syndrome so that I can begin to prepare myself, and I felt that they were, they knew what they were bargaining for, I think that would be a reasonable course of events. But just to do it for the sake of obtaining some information,
just in case,
that you're not going to deal with in the way that many people, i.e. by terminating the pregnancy, I think that's meddlesome. Because the procedure itself, although it's done very safely nowadays, even it carries a small risk to both the fetus and the mother. Very small, but nonetheless a risk. I don't know who was. Go ahead.
Okay. On the previous topic, you mentioned if a person is spiraling downhill, possibly still conscious, but spiraling downhill and wants to withdraw care, which nearly guarantees their passing away. The church condones that. Is that?
I think the church would condone if someone who is clearly dying. Mm-hmm. Is being kept alive by artificial means that they would not normally have access to if they were dying at home, for example, such as an intravenous. I don't think the church would have any strong objections to, not necessarily run in and yank out the intravenous, but the next time that it falls out, because they're meant to be changed every 24 to 48 hours, just make, after discussion with the family, decide not to reinsert it.
So my confusion is, we're very active against things like euthanasia.
Yes.
And it could be the same particular circumstance, just a brain tumor in the wrong area, and the person has lung function, let's say, mm-hmm. at which point they're going to live for a little bit longer, still spiraling downhill. So why in such cases are we against something like euthanasia?
Well, euthanasia, properly understood means that you're actually actively instituting a measure that will end their life sooner rather than later. Mm-hmm. But in the case of someone who's spiraling downhill from a massive brain tumor or something, where it would, maybe they're able to participate in the decision making, or the decision is made with their family to decide not to put down a feeding tube or an intravenous, I think would not be against the church's teaching.
I think there's a difference between actively trying to speed up your death, active through your own means, and passively allowing death to naturally take its course without extraordinary supernatural measures. But I think there's a qualitative difference there.
I guess my confusion is, so what's passive at this point? Because if a person can still eat but refuses to eat, is that still considered passive?
I mean, if they're refusing to eat because they've had chemotherapy and they're nauseated and etc., I don't think they should be. If we know that that's going to, disappear in 2 or 3 days, I think to feed them artificially until their appetite come back would be perfectly legitimate.
But if suppose they're suffering and they just refuse to
then eat. If they say, look, I don't want to eat anymore, I think we'd have to honor that.
And that would again be condoned with the church.
I believe so.
So at that point in time, the act of refusing to eat seems to me just an activist process, just as an active a process, if that makes any sense, as doing something like that.
Except who's making the decision, though?
The patient themselves.
Well, I don't think anybody should, any adult person, I don't think should ever be forced to eat. Well, I better be careful about taking blankets. Yeah. Especially with all these Mediterraneans. But no, if someone knows that if they understand clearly that they're dying, and that and they, for it's likely to be a combination of factors. They're not hungry. Maybe it's uncomfortable to chew. They don't want a nasogastric tube inserted because they've had it before and they don't like it. It's very uncomfortable. uncomfortable to go in, and it's uncomfortable to stay there after a while.
But I was just using the example of eating as a side example, not necessarily because I have a nasogastric. Suppose it was so I was going to take that and go, okay, because eating is an active process. It seems to me that we take our advancements in technology and call it extraordinary, like out of what is normal, but it's normal now. So when refusing what is normal now, that seems to me to be just as an act of a process as euthanasia.
But isn't there a difference between the person themselves saying, I don't want that, as opposed to me as the physician coming along and saying, I'm taking out your nasogastric
of course,
tube?
but the person themselves saying, I don't want that, is actively the person saying, I don't want that. And then when the person wants an injection, that's the person saying, I want the injection. Or whatever drug they use, it doesn't necessarily have to be injected like this.
Well, yeah, except that you'd have to ask me to give the, you know, to administer the medication to shorten their life. You'd have to ask someone else to do it, for one thing. Moira, yeah, sorry.
I was just thinking here, although I hope everybody leaves some questions for me and before we
yeah,
but I think there's a huge distinction, you know, that has to be made and is made when we're talking about eating at the end of life, and as you're saying, Father Cyprian, when people are actually dying, and that stopping eating, that loss of appetite, is a natural part of the of death in progress. And so so to say that the person who's refusing food is completely different from the sort of person who goes, perhaps to say, on hunger strike, or perhaps more often people who stop eating because they want to die and they literally starve themselves to death. Now that is, suicide really,
yes.
And euthanasia if anybody else participates. But I think to make the distinction that when people are actually dying and they don't want to eat, it is a natural progression. And so we just let that happen because it is happening. It's not an act of the will that's saying, I want to die. It's actually happening to them, and they're reacting to that. And I think that's where the distinction is. And it really clarifies it for lots of people, because most people are very concerned when their loved ones at the end of their lives are stopping eating or can't eat. It's such a natural thing for us to be concerned,
right.
But we just have to, at that stage, but when the person is dying, see that it's part of that dying and go with it. It may seem harsh, but I think the fact that it's coming from the person himself or herself is a big message to us that they know themselves almost, and they're going with their own bodily reactions. Yeah.
I think that's where I was confused. I thought that's what I meant by refusing to eat, just an active decision, I don't want to eat. Just
with the intention of shortening their life. Yeah. So I think that would be
quite.
I think sometimes when people do that, for example, there's an interesting psychiatric study. Many of you may have heard of Dr. Kevorkian, the so-called Dr. Death, who devised this machine for basically allowing people to end their lives by lethal injection. Now, there was a study done by a psychiatrist who looked at the cases, if you like, of people who had requested Dr. Kevorkian to end their lives, and discovered that the vast majority of them were suffering from clinical depression. And in a few cases, when those people were simply put on antidepressants, nothing had really changed. They knew that they had a terminal illness, and but they had no wish to end their life anymore. And so if someone said, I'm stopping eating in order to die, I would wonder if maybe they, for example, are depressed. I mean, is there some other thing? Are they afraid they're becoming a too great a burden on their family, and they want to get it over with, and therefore, But I think that's a different thing from what, from the person who simply, eating carries no relish for them. They don't feel hungry. They maybe even are nauseated. They just refrain from eating because it's unpleasant. I think the church would have no problem with that.
I just wanted to, I think also the whole sense of community and where you are comes into play in that. Because let's say someone here that stopped eating or doesn't feel like eating, we're much more likely to try and intervene, take them to the hospital and so on. Or let's say somewhere in a village, you know, somewhere where people over the years have been dying and loss of appetite is just a sign of that, would take it much more differently, and the family wouldn't try to intervene. They'd just be like, oh, it looks like it's near the end, sort of thing. So I think community plays a huge role in that.
Yeah, we've taken the
Yeah,
joy
oh,
out
very
of
much.
dying. And
Yeah.
one of my elderly relatives back in Greece, I mean, my gosh, I remember we moved her into the living room so she could watch everybody going up and down the street, and gradually towards the end, no, she didn't eat anymore, and towards the end she wasn't really drinking, so we just made sure her lips didn't get chapped and whatnot. She just passed away on the couch one afternoon, but it was like, yeah, she died amongst us, you know. That doesn't really happen here, which is, I think, too bad, really.
You should,
Do you have time for another one? I was just, I find your 4 theological principles very rich. And I think that if we listen to them, if we really hear the challenge in them, that most often we'll know what to do. But I think also for Christians we have the bigger question that we don't live in a Christian society, and at least most of those principles they're not general in Canada. So we also have sort of the meta-ethical question of how do we be all sorts of professionals or just people in a culture where those ethical decisions are being made all the time, and all sorts of things that we do support those ethical decisions. So I don't know if you have any thoughts on how we engage in that dialogue in the secular world. That you were in a secular hospital.
Well, let me tell you a story that happened. It happened the last month that I was practicing medicine. It shook me profoundly. This is a youngish couple from France. And I was not aware of this, but apparently the medical system in France is incredibly paternalistic. The physicians basically make the major decisions. It was not something I was particularly aware of, and I don't know if it's still true, so I wouldn't want to be quoted. But this was only 5 years ago. This couple's 4-year-old only son had his tonsils removed. Probably didn't need them removed, but he had them removed. And after going home from the hospital, had a major bleed, which is an occasional occurrence. And by the time they got him to hospital, he required resuscitation, which was successful in terms of restoring his breathing, or his heartbeat and so on. But he was in a total neurovegetative state. And the parents said, we have no intention of dealing with a handicapped child. We're not interested in it. We're not able to. We want you to stop feeding, all measures for this child's nutrition. I had got to know these people fairly well because there were some comfort issues around the child's general condition, and they had asked the palliative care service to see, and I started talking to them, and it was like we inhabited 2 entirely different universes. I couldn't even begin to talk to them about taking up their cross. I mean, it was impossible. And the ethics committee met and pondered this decision, and finally it was decided that this is a minor child, cannot express his own opinion. The parents are the surrogates for this child. They have the right to make. We have to respect their decision. That's pretty much the way things go in Quebec, in particular. So, intravenous fluids were stopped. The nasogastric tube was removed. Without going into normal detail, I can tell you 3 weeks later that child walked out of the hospital. And people were just, I still haven't really recovered from it. Because although I abstained in the vote at the ethics committee, I still felt somehow complicit in it. So I really don't know, and how we who hold up a particular vision of what it means to be a human being, of what good and authentic human life is, how do we begin to deal with the wider society? Except, let me conclude that rather somber analysis with one thing. I believe that many people in the society who, for example, would claim that they don't believe in God are still living off their Christian bank account. There are many people who still believe that human life is sacred. And if I were going to have in a non-emotion charged situation like the one I just described, if we were just going to have a philosophical discussion, I would pin them to the wall and say, well, why do you consider it sacred? What's wrong with what someone like Hitler decides to do? You know, I mean, you know, make them think out loud about some of the convictions that I believe. Many of the convictions that I elaborated, I think, are still, you know, that human life is sacred. That, you know, the average person of goodwill in the street, I think, still believes that, despite their apparently contrary claims to believe that Christian faith has any relevance for their lives. So I think that might even provide us a platform to begin to talk. Yeah.
Just very quickly, because I know we're running out of time, but with the principle of autonomy, is there not a way to reconcile still that principle with orthodox values in a particular framework? In other words, yeah, we take our loved ones, the community, into account. We hear what they have to say. They hear what the patient has to say. But at the end of the day, it's the patient's decision, because it's their life. Yes, it's God's life that they have given them, but it's their life they have to live. And so I'm just trying to say, maybe it's not so mutually exclusive. Maybe autonomy in one sense is still a valid principle, but it doesn't mean it's just me and only me. But it means I need to realize God's in the picture, community's in the picture, but at the end of the day, the choice is mine.
Mm-hmm.
And free will has been a value that's always been very highly esteemed in Orthodoxy.
Right. And I tried to mention on a couple of occasions that I thought that autonomy had become so important for some very good reasons, because in that medical setting, its opposite is not community, its opposite is paternalism. Mm-hmm. And autonomy, I think, was a healthy development as far as it went, because its aim was to empower people, not just the isolated individual, but the individual and their family, with the ability to make good choices. But I think you're right. I think that in the end, you know, if I were pastoring someone in that situation and I were satisfied that they had listened to their family and had decided on a particular course of action anyway, I would feel obliged to support them as best I could, even if I didn't really approve of it. I wouldn't walk out of the room and say, well, I'm not giving you communion anymore. You know, that's not my job. In the end, because of our strong understanding of free will, I think we have to. But it's just the notion that the notion that I was arguing most strongly against is it's my life and I'll do what I want with it, and that ain't true. Yeah.
I just wonder, this is a little bit of an aside, but we hide death so much in our culture.
We what?
Hide it. We try and suppress the idea of it. I've read good books about the physical reality of death. I mean, I think as I look at getting older and that I will die, what can I expect?
Well,
I mean, is that helpful?
Most of the potential authors have left us. No, but we have descriptions of there are people who there was a man who's now dead, Father Richard John Newhouse, who was a former Lutheran pastor from Canada actually originally, and eventually became a Roman Catholic priest, and he had a very major insult as a result of a ruptured bowel because he had cancer. And really, he was in ICU and was basically on death's door. And he described very, very vividly what it was like, what he saw, what he heard, stuff, you know. So I suppose there are enough of such accounts that someone could collect them and try to write a book that will be, what will it be like when my time comes? But I think this walk is so individual.
I just meant things like, say for people having loved ones that are dying, to know that a natural part of it is that they will stop eating and drinking.
Mm-hmm.
That might seem self-evident.
There are things like that available out there already. I mean, at that kind of, you know, instrumental level. Anyway, I think we've gone on.
So thank you, Father, very much for. Next week we'll meet also at the same time. What is the subject for next week?
Talking about reproductive technologies and a bit about stem cell research and some of the ethical issues involved in those.
So right now we'll have Compline for anyone who would like to stay. Right?